Well, among the hidden costs of the COVID-19 pandemic is an alarming rise in domestic and intimate partner violence. Joining us to discuss this topic is Laura Clary, Clinical Manager with GBMC's Sexual Assault Forensic Examination Program. All right, so talk to us about how the Safe and Domestic Violence Program at GBMC is helping during the pandemic.
So the Safe and Domestic Violence Program is a program that is available 24/7. We are staffed by forensic nurse examiners and victim advocates, and we respond into the hospital to care for patients who have been a victim of sexual assault, child abuse, or intimate partner violence or human trafficking.
Okay, so walk us through that process. If a victim of sexual assault or domestic violence comes in, what happens?
So we get patients numerous ways, but I think the most common way is that they come in through the emergency department. Our job at that point is to try and go up and do an immediate intervention where we meet with them, talk about what happened, try to get them down to the safe suite, separate them from the ER where sick people are as quickly as possible. We do have some cases where we have them come directly into the safe suite and bypass the ER completely, again, with the goal of just keeping healthy people away from where sick people are in the emergency department.
And so have you seen an increase in the number of victims during COVID?
We have. So we were actually in the beginning kind of alarmed because our numbers actually plummeted in the very beginning of the pandemic because people were afraid of the hospital. They didn't feel like they could get here safely and they were trapped inside with their abuser. As things started opening back up, we started seeing an influx in domestic violence. We started seeing an influx in the severity of the cases that we were seeing with a much higher level of lethality. And that's something that we're going to be looking at with this new surge. We want patients to feel safe coming in and being able to seek treatment with our program.
That's what I was going to say. So it seems like we're heading to lockdown and quarantine again. Do you have any tips for people who may be in a dangerous situation?
So we do. So one of the things, we try to make our services always accessible. So we are available 24/7. We are also available by phone, and we have a very informative webpage. If you go to our webpage, there are lots of resources, not just here at GBMC, but around the Baltimore County and city community, where people can reach out and get assistance if needed.
So let's say that somebody is watching this and they say, I need that program. I know somebody who needs the program. How do they find you?
So they can go and do a Google search for GBMC Safe Program to find our actual webpage, or they can call our office line, which is 443-849-3323. We are available in the office and also have a confidential hotline.
All right, perfect. Great information, Laura. Thank you as always for joining us, and thank you for the work that you're doing.
Thank you so much for having me.